Okay, sir. We're gonna start. A very good evening, everyone. I, Shubham Bharti and Misbah Kadri, will be the moderators for today's session. We welcome you all to Cynodent Webinar Series 2023. The theme of the series is Unlocking Trends in Dentistry. And I would like to invite our speaker, Dr. Jayashankar Pipillai, sir, the BDS and MSc in Forensic Odontology from Department of Oral Pathology, Forensic Odontology and Dental Anthropology Unit, Government Dental College and Hospital, Ahmedabad. And for today's session, the topic is Bitemark investigation in forensics. I would like, sir, to please start with the presentation.
Yeah, thank you very much. And I hope my screen is visible. Fine. Thanks for this introduction and giving me this opportunity. Thanks to Cynodent India. Yeah, so this is a topic which I have selected for today's webinar because this is a topic which is not only for the undergraduate BDS students, it's also one of the topic of interest for the postgraduates in oral pathology and oral medicine subjects. And also a topic which is highly controversial in the field of forensics. So I wanted to give a brief introduction and the basics of the forensic and also the forensic importance in the bite mark injury, how the investigations are carried out, what is the basic of those injury patterns, and the protocols to be followed. However, there are also certain limitations in the investigation of bite marks. Those issues also will be addressed. Now, research on uniqueness of dentition, because this is a very generation of a huge database is required, and authentication of the uniqueness of the human dentition is also much required. So those things will be addressed. So I go full screen now here. And yeah, so before starting, this is the place from where I come, and this is being live streamed from this Ahmedabad, in a state in western part of India, a vibrant state, rich in culture, tradition, in wildlife also. And here in Gujarat, the oldest dental college is my institute, the Government Dental College and Hospital, where I work. And this was one of the oldest dental institutes in India. It was established in the year 1963. So this is the one which you see as is the old building here. There's an old structure, what you see here, and later on it was renovated and modified recently. And to add feathers to its cap, this is the institute with NAC A plus and also NABH accreditation. One of the few government institutes in India having all these accreditation on the first go. So this is one of the highlight I wanted to mention here. So this is the institute from where I work. Now, in that institute, the uniqueness of that institute is that it also has got a center or a unit on forensic odontology and dental anthropology, where a committee works, that is the age estimation committee, because this institute is a referral center for many organizations, many institutes for age estimations. So we do get age estimation cases and also the dental evidences in forensic related cases from Sports Authority of India, from the BJ Medical Forensic Medicine departments, and some cases from High Court, and also from some child welfare organizations or NGOs also. They bring their subjects for age verification. So it has got a unique setup here on the 6th floor of the building. So this is the setup what we have currently. Another thing is this institute has got a MOU or a collaboration tie-up with the National Forensic Sciences University, the only university in the world which is imparting the knowledge on all topics or subjects related to forensics. So this is situated in the capital city of Gujarat, that is Gandhinagar. So Government Dental College has got a MOU. Twice it had got an MOU with this institute. And yeah, this is the institute where I also did my post graduation in forensic odontology. So this is now rechristened or converted into a university of national importance. So it is under the Ministry of Home Affairs, Government of India. So this is now a National Forensic Sciences University. So there is a collaboration with the GDCH Ahmedabad, and this for imparting the theoretical as well as the practical knowledge on forensic odontology subject. So now coming to this topic, that is bite mark injury and its investigation in forensics. So myself, Dr. Jaishankar. So I'm the Honorary Secretary of Indian Association of Forensic Odontology, also the Board of Directors of Association of Forensic Odontology for Human Rights. And I've also done my fellowship in forensic odontology from Indian Board of Forensic Odontology. So now we go to the topic of bite marks. So when we talk about bite marks, it is a combination of the two entities. One is the bite entity and another one is the impression or the mark, the pattern which is created by because of that bite on a skin or on any inanimate objects. So to understand the bite mark concept, the students need to understand this entity separately. You need to understand the bite component first and also the mark component, because when we do the investigations, it's like that we have to assess the mark as well as the dentition of the accused person. So that is why we have to take this as a separate entity. Now first understand the bite component. As a student of dental colleges, we teach we know that the students learn about the bite in their undergraduate curriculum. It's something like a skeletal-muscular phenomena. It's a dynamic process, a physiological process where because of the intercuspation. So in terms of mastication, in terms of occlusion, we teach the students about this pattern. Now in that, if we add the skin component into it, then it becomes a bite mark component. So we will now see the mark component. What this mark component is, it is nothing but a patterned injury. Okay, it is the registration of the what do you call, the cutting edges of the teeth, or in short, I can use the word the incisal edges of the teeth on the skin surface or on any inanimate object. So sometimes it is just the impression of the teeth, or they sometimes occur in combination with other structures like the tongue marks and the lip trains. All that also need to be investigated. So if you want to define a bite mark, then it is nothing but a patterned injury in skin or a pattern on any object which is caused by the biting surfaces of the human or also by the animal teeth. Because sometimes we need to differentiate between a human bite mark and the animal bite mark. So that is why comparative dental anatomy, the dentition pattern of the non-human also have to be considered here. So moving next to that is the location of the bite marks, where the bite marks occur in the human body. So most commonly, because these are all based on the various case reports, various evidences, that majority of these cases, the bite marks are seen on the face, the head and neck region, the chest, the breast, the arms, shoulder, thigh. So not necessarily in these areas only the bite marks are occurring. There are also reported cases where in India itself, where even on a bite mark was investigated on the male genitalia. So that case also was reported here in India. So it's not necessary that they occur only in this. So these are based on the evidences and earlier case reports. So, but majority of this, if you see in the face and on the breast, chest, the arms, so these are all the common areas where the bite marks are located, need to be looked for. Then bite mark cases occurs where? In which type of crimes? Mostly the violent crimes, when there is a physical assault or sometimes sexual assault in case of rape. Then also in sports injury. I think you are all aware of the classical example of the Mike Tyson and Evander Holyfield, that sports event held at Nevada. So it's common that during sports, also the bite mark injury is common, especially in this contact sports. Sometimes, in self-inflicted bite also, some, unwillingly or self-inflicted cases, usually, where the accessible portion of the body, I may be able to bite my up forearm, but may not be possible to bite my cheek. So this is very important, evidence actually. If the bite mark is on an accessible area of the body, then we always have to look for the dentition of the victim itself, himself or herself. So we need to investigate that first, and then we need to go for the investigation of the dentition of the accused person or other person. In murder cases, child abuse, very common, bite marks are there. These are all criminal cases. Even in theft and robbery cases, the the thief enters the house and he opens the fridge, takes a chocolate, he just bites, takes an apple, what you see here, takes a bite and just leave that evidence. So he's leaving his saliva, DNA, also his pattern injury in that house. So this is also again need to be considered as a bite mark case. When we see the component, this is very important. Earlier what I told was the bite mark. There are two things. One is the bite mechanism and is the mark mechanism. But when we are talking on an investigation part of view, we need to understand these three things. One is the dental component, the second is the skin component, and third is the episode of contact. The dental component mainly deals with the arrangement of the teeth, the arch pattern, because that will give a clear-cut indication whether it is a human bite mark or an animal bite mark. The arch pattern and the teeth arrangement will also give a very clear-cut indication whether it is by a child or by an adult. The intercanine distance will be very useful in differentiating the adult bite mark and a child bite mark. So that's again the dental component is the arrangement of the teeth. Sometimes, the rotation of the teeth, the angulation of the teeth, the interdental embrasure, spacing, all those things constitute the dental component in the bite mark investigation. Okay, the skin component, if you see, because we all know that the skin is a viscoelastic layer, so and also the thickness of the skin is not uniform everywhere in our body. Okay, and also the underlying subconnective tissue. So you can very easily say that the scalp and this facial zygomatic region, that the skin layer is thin. The subconnective tissue or the fat or the subconnective components are very less. So they also play a very important role in registering that bite mark. So skin component, the aging factors, especially, the color of the skin. So these are all the components coming under the skin component. So, and third, and the most important in forensic investigations, I can say, is the episode of contact. That means these three are independent. Now we are studying bite mark because of this third. There is a contact which is happening between that accused dentition and the victim's skin. So that is the episode of contact. Now, forensically, if you see, they give very crucial evidences, not only in linking the victim and the accused, but also they will help or give clear-cut clues regarding the direction of attack. Because when we dentists can identify from the impression that which is the upper arch and which is the lower arch. So if we can see, identify or differentiate the upper and the lower arches, so it is very easy to, easy to understand that the direction of force or the direction of impact or the direction of contact. Suppose one classical example I will give. If I have on my shoulder, there is a bite mark, okay? And in that bite mark, I see the upper teeth, the mesodistal width are very wide. The upper teeth are lower and the lower teeth are upper. So that itself gives an indication that someone has bitten me from behind. Because when they bite from behind, their upper teeth will be lower here in front region and their lower teeth will be upper. So that evidence also will be useful, especially in recreating the crime scene. So it's not like bite mark investigations are only conducted to link the perpetrator of the crime and the victim. It may be also useful to understand the episode of contact. That means from which direction the person was attacked. So that type of evidences. So that history also will be useful. That means the victim will be giving some information that the accused has bitten me from front. Okay, but in that bite mark, it will be reversed. So that will be useful in extracting the real truth, or understanding the real truth behind that particular incident. So episode of contact is also one such thing we need to understand. And you see here, the episode of contact will give all these considerations to force, the pressure, the time, and also the relationship of the mandible and the maxilla of the biter, the movement of the assailant and the victim. Sometimes there will be resistance from the victim when a person is biting, so that will generate or create some amount of drag marks on the skin. So that incidents also will be, that evidence also will be useful in recreating the crime scene, and also may give some evidence regarding the assault, the nature of the bite, the mental status of the victim and the assailant, and the pain threshold of the victim. So all these factors contribute for the episode of contact. So these are all the important points, when we do the investigation, we need to consider. For example, you can see here in this image itself, it's a light indentation, very not that much clear, but here you can see even sometimes the clothing on the skin also may contribute some amount of evidence, like the sometimes only the upper teeth will be present, the lower teeth will not be there, so the clothing will be more towards the lower teeth, so that also need to be considered. Now, when we classify bite marks, because sometimes we ask the students, so broadly they classify as a human and a non-human bite mark. When you consider a human bite marks, we deal with forensically on a criminal scale and a non-criminal scale. Like one is having the forensic and criminal implications. So mostly it's offensive and also defensive. Sometimes the victim bites the accused, so it is not necessarily that the bite marks are seen only on the victim's body. Okay, for a defense also, the victim may bite the perpetrator, so on his forearm. Most probably it will be seen on the forearm of the accused person. So that also evidence need to be extracted. A non-criminal bite marks are also seen, mostly love bite, what we call it as a hickey. So those are also, but not on a criminal point of view. They are routine, and this is not considered as a criminal. So self-inflicted bites also maybe, especially lip bites, and this is all very common. Non-human is the only thing is animal bite marks. But for an undergraduate student and also for the postgraduates there, the main classification, the most commonly accepted classification of bite marks is this McDonald's classification. We all commonly ask this in the third year of BDS. The most commonly followed classification, it is purely based on the etiological aspect. So etiological classification is all these four you can see there, based on the tooth pressure marks. So only the indentations, only the mark created by the incisal or the occlusal surfaces of the teeth. Then the tongue pressure marks, it depending on the amount of tissue which is going into the mouth, and also the suction and the sucking capacity. So all these are considered for the tongue marks also. Then the tooth scrape marks also, some, as I mentioned earlier, that because of the resistance, so there is also possibility of scrape marks. But these scrape marks are also very commonly seen on foodstuffs. Like if you bite an apple, you what you do is we just create the indentation on the surface of the apple. But when we make a complete bite, what we do is a scrape mark. So when you just bite an apple, you can see even a chocolate. So it just scrapes. So that type of marks are also forensically have got an evidentiary role, because the mesodistal dimension of that plays a very important role. So those need to be taken impression and replicated and then investigated. And the last one is the complex marks, where it's a combination of all these things, because when there is an when that episode of contact takes place, it's a wide variety of range. What I can say is a range of injury pattern which is created. So we will see all those in later slides. This is the nature of the bite injury. Like it depends on, again I'm telling you, the force, the biting force, the time, the sharpness of the teeth, the resistance from the victim. All those play a role in this type of injury pattern. The most common is the bruise, this indentation and the abrasion, laceration, and even sometimes to the avulsion of tissue. What happened in Evander Holyfield is this, the part of the ear is gone. It's totally avulsed. So there are cases where even the nose was bitten and it was torn, and it was totally loss of structure was there. So again, remember, it depends on the severity of the bite. It may be from a mild contact, just a small impression of the teeth, to a complete clenching. And, it may be resulting from a contusion or to a complete avulsion of the tissue. So based on that, for all the investigators to refer, the Ayan pretty, this scale, severity scale was given. So we usually refer to that. It's one thing is very clear, that the more severe the bite mark pattern is, that means if the tissue is more avulsed, okay, more lacerated, then the forensic evidentiary role decreases. At the same time, if there is no indentation of the teeth on the skin also, the evidentiary role is very less. So the forensic significance will be more high when this type of impression or this injury pattern is seen. That means some obvious bruising with small laceration associated with the teeth, and most severe aspect of the injury likely to be assessed as a definite bite mark which has got a high significance. So this is the index which was given, severity, in fact a scale I can refer, and this I also have got a reference images side by side. Another information which the forensic odontologist or the dentist can give in an investigation is also the aging of bite mark. So here, most of you would have studied in oral pathology, that is healing of wounds. There's a chapter. After injury, there is a healing mechanism which is taking place. And based on the histological as well as the physical changes which are taking place on the wound, the color also changes, and based on that color, it is possible to judge the age of that particular wound. The same is applicable here in bite mark injury also. So from fresh injury, it changes its color to 2 weeks. So based on that, we can assess or judge the day or date or tentative time period of that particular age pattern. Uh, there are also colorimetric scales available, like the one which you can see here, which can be used. But again, it depends on the color of the skin of the particular person, victim, and also from which part of the world, this has to be customized to that particular population. So this is a general one which was for the European population, which was designed. So this can be used as a reference material. And another scale which I always recommend when we have to use bite mark photography is this ABFO number 2 scale. This is a very useful scale, especially for photographing the bite marks and also for any dental evidences. So this is the L-shaped scale which we regularly use for the bite mark photography. Now, how to identify that particular injury as a bite mark? So it has got a gross feature, some class characteristic, and also the individual characteristics. So it is very common to say it is very easy to find out that which is the upper arch and which is the lower arch, because we are well used to the dental anatomy and also the arch pattern. So we can easily classify this, which is the upper arch and which is the lower arch, and also the shape of the arch. Based on the size of the arch, it is also possible to find out whether it is a human bite or a animal bite. So that is a class characteristic to distinguish the tooth types in the bite mark. And also we can say that the anteriors have a very straight incisal ridge, especially the incisors, whereas when it comes to canine, it has got a pointed incisal edge. Okay, so there is a cusp concept starting from that tooth. So that cusp, sharpness of that cusp will not create a pattern which is somewhat rectangular or squarish. It might produce a pattern which is somewhat like a triangular pattern, what you can see here. So this is very important to know, that because when there is an anterior teeth component involved, so if the canine is prominent or canine is sharp, so that particular point will have a clear-cut indication. So very clearly visible. So the canine's intercanine distance, as I mentioned earlier, was also very useful to differentiate between the adult and the child bite marks. So the rectangular pattern of the incisors, the triangular patterns of the canines, and obviously when we go to bicuspid, so there is a possibility that we encounter two such triangles, one smaller and one bigger. So that will help us in identifying this particular tooth is incisor, this particular tooth is canine, and this particular tooth is premolar. So this is called as the class characteristics. Now, individual characteristics, if you say, for example, one particular tooth will be rotated. So, for example, you can see here itself. In this, one of the central incisor is what I can say is a unilateral winging. There is a mesodistal slightly rotated. So this is not in line with the rest of the teeth. So this particular person has got an incisor which is slightly showing the unilateral winging pattern. So this can be considered as a individual characteristics. Another classical example I can say is the midline diastema, where there is a spacing between the two central incisors. So in the bite mark also, there will be a huge space which is not affected by the bite. So that particular portion will indicate that there is a diastema in that particular biter dentition. So this will be useful in narrow downing the evidences, narrow downing the search of the accused person. So that is why these individual characteristics will be very useful. So this is the typical, I always show this image in any forensic bite mark lectures. This is a classical picture of a bite mark where we can easily make out that which is the upper arch, which is the lower arch, and where is the canine and where is the incisors. And sometimes, based on the tongue pressure, on suction pressure, there is a creation of hemorrhage in between the two arches. So this is again a very important evidence, the amount of pressure. So that is what, not only the tooth component, the skin component also plays a very important role. The physical characteristics of the bite mark, if you see, this I have already told. The maxillary central incisors are wider. The central incisor mesodistal width is wider than the lateral incisor. So this will be useful in differentiating intercanine distance. So all these I have already mentioned. Now, the bite mark investigation point. Now, why we have to do this bite mark investigation? Only for two reasons. One is the outcome of the investigation will either help in successful prosecution of the accused. A very clear evidentiary role is there in the bite mark. You proceed with that case and you do the investigation, and that report will help in the law system to prosecute the accused. Okay. Sometimes innocent people are also falsified, false statement. They give, they are caught of their innocence. They can be acquainted, so they can be released. That way also, it will help in differentiating. For example, I can say the bite mark injury pattern has shown rotation of one particular incisor. Okay. But here in this particular person, there is midline diastema. So it's very clear-cut indication that this person is not the biter. So he can be acquainted. Now, when we do the investigation, the most preliminary questions which arise, which the investigating officers, they usually ask, is this injury a bite mark, human bite mark? If so, is it caused by an adult or a child? So these are the questions which is put forth. Can it be compared to a suspect? Or does the bite mark correspond to the time and type of the crime? Yes. So that is why I was talking about the aging. The statement given by the victim would be something different, which may not be exactly correlating with the aging, what you have, predicted based on the bite mark healing pattern. So these are all the things which need to be answered during the bite mark investigation. So what we do during the analysis, the bite mark analysis process is very, very important because it deals with the recognition. First, we need to identify it is a bite mark, yes or no, yes. Then if it is a bite mark, is it caused by a human bite mark, yes or no? Like that, we need to make some chain of questions. Then if it is human bite mark, then how to collect that bite mark, how to document that bite mark, how to evaluate that bite mark, and after doing that evaluation or the comparison, how to interpret your result. And after you have done all these things, how to write the report. So if you want to master in a bite mark analysis, it's not only the comparison you should be well versed with, all these components are important. So how to describe the bite marks? There are various guidelines given. ABFO guidelines are there. There are several organizations which have given their guidelines for describing a bite mark injury. Okay, and also the protocols for collection. So those guidelines need to be utilized. So this basic evidence, if you see, it is a two-dimensional evidence, a photographic evidence, three-dimensional evidence. Sometimes we use the impression of the bite mark. And nowadays, with the advent of technologies like the 3D scanners and all, so 3D evidences also can be generated. Now, bite mark evidence collection, a word of caution, because there is amount of when it is bitten, some amount of transfer of saliva is also involved. Okay, and infection control protocol also need to be followed meticulously in such cases. So the bite mark evidence collection, either we collect from the victim or from the assailant. Okay. Evidence collection from the victim. How we collect the evidence from the victim? So we have identified it as a bite mark. We know it is an injury evidence. Now there is a protocol, because sometimes the photography is very, very important. But if it is a fresh bite mark pattern, that means very few hours back only the incident had occurred and it is reported now. So there's always a chance of getting the salivary DNA from that bite injury. So there are protocols for how to collect the saliva traces from the bite mark injury. Double swab technique is also there. So before taking the photograph, it is always wiser to take the DNA evidence from the site, from the bite area, and then go for the photography, because the flash light, the UV photography sometimes we take may unnecessarily degrade the DNA, so that DNA evidence may be lost. So the first and foremost is take the swab and then proceed with the photography. So in the photographic evidence also, there are, I'll be discussing later, various types of protocols to be followed in taking the photographic evidence. Then impression and also preparation of the cast, because that will be a permanent record of that particular injury, because on a live human person, the injury will be healing, so the evidence will slowly lose its evidentiary role. So making an impression and preparing a cast of the bite mark will always be useful, so that at later stage also can be considered. When we take the photographic evidence, it's always compulsory that we take two photographs. One is called as the orientation photographs. That means from a long shot to exactly locate where that bite mark injury is. Suppose if I go and take a very close-up photograph, even an expert may find it difficult which part of the body that particular bite mark is there. So that is why you always have to take an orientation photograph showing the other regions of the body, and also a close-up photographs. Again, it is also recommended that we use a scale like the one which I mentioned, ABFO scale, before taking the photographs, while taking the photographs. And we need to take one with the scale and also without the scale. I also consider, earlier when there is no digital technology, digital cameras were there, they used to take color photograph as well as the black and white photograph. But now with the digital era, it is possible that we can even convert the colors there. Then also the altered light source photography, UV photography, infrared photography also will consider. Now, when we are taking this bitemark photography, the standard protocol includes the orientation, the proper orientation of the slots. So if you remember that ABFO scale, which I showed earlier, there were two rings actually, on three rings there. You can see from here. Okay. So now if you are orienting your camera or your lens exactly perpendicular to that particular scale, and the scale also should be placed on the same plane of the bite mark. If the bite mark is on a curved surface, then we need to take multiple shots of the same images in two different angles. But the thing is, the circle should be, this will help in telling whether the particular photo is distorted or not. Because when we do a life sizing of that particular photograph, so that circles will be very useful. So they also have to be very in a circular form. Because if I change the angulation, that circle may be sometimes elliptical or sometimes oval like that. Okay, so this is what we need to understand. There are guidelines, I would recommend that people who are using this digital imagings in forensics, using the photographic comparison in forensics, refer to this protocols or the SUGIT guidelines, which is given here. You can take this address and you can freely download these guidelines and follow the guidelines mentioned in that. So this is one important point I wanted to tell on the bite mark photography. Now, so this is a typical prototypical human bite mark injury. You can very clearly make out that, there's the upper arch and this is the lower arch. Now we took this is one of the cases we got, and we took the impression. and that dye was prepared, and we also have a permanent record of the injury. What you see here, it is having the injury. So this is the bite, this is the ABFO scale I was mentioning. Now the bite mark evidence collection, what we saw is from the victim. Okay, now the collection from the suspect. So once you have confirmed that this is a human bite mark and it is created by an adult bite, okay, so now we ask the police or the investigating officer to produce their suspect. If they have already got some suspect in their custody, now to prove that that suspect only had bitten, so now it is our duty to call for them, so that we do the second part of our investigation. Forensic investigation, the first part is evidence collection from the victim. The second one is the evidence collection from the suspect. So here we do the clinical examination, like how we do in a routine patient work, sitting in a dental chair, make them sit in a dental chair in a proper illumination, photography. We also take reference saliva swab, so that in case if there is a swab taken from the victim from the bite mark, so there will be easy for comparison, so that the DNA analysis can prove it. And also the impression, their upper and lower dentition impression. Clinical examination, we do thorough clinical examination, dental charting, photography, like how the orthodontists, they take the photography in their cases, in occlusion, in open bite, sideways, frontal, everything. Maxillary arch, mandibular arch, and also we do a bite registration using a routine bite registration wax or your red wax, modeling wax. So this is how the upper arch photography is taken using the reflector lens, reflector mirror. We take the lower arch. So dye is prepared. We prepared the models, upper and lower arch. So we also apply this model on a what do we call that, ink pad, where for taking the fingerprints, they use the ink pads, isn't it, sir, for rubber stamping. So just apply that, so that it creates a contrast. But it's not compulsory. If the evidence, if the arch pattern as well as the incisal ridge is very clear, then we can easily scan them using a flatbed scanner along with the scale, so that this will create a 1:1 image. But the photography of the bite mark will not be 1:1. So that need to be life sized. So these are the protocols we follow. Then we just trace the overlay. What we do is we maintain the custody, chain of custody. This is very important. Even when the victim is coming as well as when the accused, they are brought separately. But we need to maintain the chain of custody, because in the court of law, during the summons, when we go, they ask for this, that who brought the case, at what time the case was brought, and which department you took for the impression. So when we take the victim or the accused to the prosthodontia department for their upper and lower impression, so we take the signature of the prosthodontist, whoever is taking the impression. It's not like always the forensic odontologist himself or herself take the impression. So if it is an institutional setup, then we go to the respective institute. For example, if you want to take an OPG of a person, then we go to the radiology department. So we take their permission, and with their signature, the chain of custody, the time and the date, everything has to be maintained. So this is very important protocol in the investigation. Now, the third component is the comparison. So we have got the evidence from the victim. We have got the evidence from the suspect. So we need to do the comparisons. There are several methods available. We do a comparison based on manual method. We do a comparison just directly on the person. If the victim is brought again and we have the dental model of the accused, then we can make a direct comparison, because it is 1:1 now. Okay. But if the victim is not brought and we are having only the photographs, then we need to do an indirect comparison on the photograph. So this is an example of how we do the direct comparison. And this is preparation of an overlay, all that things. Now, what is that overlay? Now we just generate the outline of the incisal area of the particular teeth in the arch or in the model. and we can generate that typical overlay on an acetate paper, or we can scan on a flatbed scanner, generate an overlay. There are several methods. I'm not going in detail about all those things, but there are several methods of generating an overlay, manual method as well as the digital methods. Okay, so that overlay need to be generated. And as I told already, computer generated, that's a digital one. And we also trace the overlay from the dental model on an acetate or on a trace paper directly. Okay, and we just have to compare it with the bite mark. So one case I'll show. And there are also other methods. We take a test bite of the person when the accused is brought to us. We also take the test bite directly, or we can have the upper and lower models in occlusion, and we place the wax sheet in between, and we press the arches, both maxillary model and the mandibular model. We generate the indentations on the wax, and we fill it that with the radio opaque material, and we take the X-ray. So that will create a radio opaque that surface incisal ridges. So that can also be used for comparison. Yeah, this is what I was telling. So we just generated the upper imprint and lower imprint. So when we just unfold the wax sheet, it will just mimic like a bite mark. So then we can use this also to trace the indentation or the outline or the overlay on a transparent sheet, and we can compare it with the life-sized photograph also. So this is the first one is the manual method, and similarly we can also do with the computer generated digital method. Then comparison, we mainly see that we have to prove, as I mentioned, go for the arch characteristics, go for the individual characteristics. So they will help us. So they are morphologically, they will help us. But sometimes some measurements also need to be taken. So the most common is the odontometric measurements. So even the incisal measurements, it varies from person to person. The orientation of the teeth and the measurements in combination also will be useful. So one such method we generated using image processing technology, like automatically, I will be discussing about that later. So how we generated automated method of measuring the angles and also the linear measurements, and we wanted to prove the uniqueness of that particular person. Then once we have done the reporting, the main part is the report, because this is the portion which will connect you with the judge, which is going to connect you with the legal system. Okay, the judge or the concerned person there, they will read the report. Okay, what investigation you did, how you did, where you did, when you did, that is not important, but they will be seeing they'll be reading the report, and finally what they will be more interested is in the opinion. Okay, so based on the investigations, you can very well say, considering the evidentiary role of that particular evidence, of that particular bite mark. So you can very surely can say that, yes, he is the bitter. So you need to have some support statement for that. If some doubt is there, you can very well say that he is probable bitter. Okay, if there are a lot of confusion, then, not excluded as bitter. But sometimes it may be totally different. The bite mark is different, and the dentition of the accused person is very different. So you can totally exclude, no, he is not the bitter. Like the one example I told, the midline diastema is there, but in the accused there is no midline diastema. So you can very well exclude them as a bitter. And sometimes, the bite mark injury is so, evidentiary may not be, evidence is not clear cut. So we can say that this particular case is inconclusive, because I cannot proceed with any investigation, because the bite mark is not giving any conclusive report. And also the dentition may not be very clear. Okay, or that type of opinion we can give. And of course, we have to give the disclaimer. Disclaimer we have to give, like, if further evidences are available, you may be subject to modify your statement. So it depends on the additional evidences which are generated, because this is the report for one person. If there are more than one accused, then multiple accused persons are there, then you need to do more time, and you need to do the analysis of each and every pairs of dental models. So this is how we conclude this. The main thing I wanted to tell here, whoever is doing work on forensic bite marks, and there are a lot of controversy going around, because there's one project called Innocence Project in USA, where many people who are convicted of based on their bite mark investigations were found innocent later on. Okay, so still people are not able to consider, in US and other countries, they are not considering bite mark as a true evidence in forensic cases. But the only thing is, take home message what I can say is, the investigation and the conclusion of your investigation depends on the quality of the evidence. That quality should be very high. If I have a very clear cut indentation on the teeth and it is possible to compare with the person's dentition, then proceed. And also, the pool of possible bitter is small. I have only few bitters, not large group, so chance of error is minimized. And the bite mark patterns demonstrate sufficient distinctive characteristics. Like as I said, in one of the cases which I did, the central incisor was one of the central incisor was fractured. Ellis class 3 fracture was there. So one particular, the disto-incisal portion was sharp, whereas the meso-incisal portion was not there. So when that bite was there, so because of the sharpness of the disto-incisal, and the meso-incisal did not create any impression. So in the adjacent central incisor, it was creating a very clear-cut rectangular pattern, whereas on the next central incisor, the rectangular pattern was not clear. So that's a very clear-cut indication. And another thing is, there was resistance from the victim, so there was a drag mark. So ultimately, the one which is having a sharper edge will create a more drag pattern on that, isn't it? So that was a clear distinctive characteristic. So if we come across such type of cases, so we have to consider these three qualities and then proceed with the investigation, because it sometimes will land us also in trouble if you give a wrong report. So this is all the word of caution I can say when dealing with the bite mark evidences. And I now keep it to the audience. What is this, if you consider it as a bite mark? If anyone can answer, it mimics like a bite mark, isn't it? So actually, it is not a bite mark. It's a insect bite. So it's an ant bite. Okay. So you can see now, such type of confusions occurs, no? Because I can see somewhere some arch pattern here, some arch pattern here, some arch pattern here. So, overzealously, we should not enter and do this type of investigation. So we are specialists of teeth, and we should restrict to our jurisdiction. So we are dental specialists. So we will rely on the tooth morphology, tooth anatomy, and also tooth imprints in forensic cases. These are the evidences, some of the cases in India which have been investigated. One was a very well-known case in Goa. This Monica's body, there was a bite mark on her body which was created by her own servant. And the landmark case, very well-known case in India, that is the Nirbhaya's case, where the first forensic odontologist, Dr. Ashita Acharya, he performed the investigation, and based on this report, in Delhi, the conviction happened. So these are the classical cases in India where bite marks were investigated by forensic odontologists. In this Goa case also, it was investigated by dentistry. Now, limitations I have already addressed. So for the younger generation, for those who are more interested in research on that, so try to focus in, if you're interested in forensic odontology, don't focus more on age estimation. There are people, a lot of people working on that. Okay, so we need to have a huge database related to the uniqueness of dentition. So this is one such study we started. One of two of my students, Dr. Divya and Dr. Rajvi, they worked on this particular project where we wanted to use the artificial intelligence or the machine learning components to prove that uniqueness of dentition. So it's a project which have been done by them under my guidance. So we found that we can generate an automated tool where you just have to make the imprint and just submit it to the system, and it will do its own calculations. So we have prepared an algorithm accordingly. It does the algorithm. It gives a result and will tell whether it is unique or not, whether it belongs to this person or not. So this type of work, it's an entry stage now. I welcome the younger generations to perform more such research works, not only related to the anteriors, even to the posteriors also we can work on that. So this is what I wanted to highlight on future. I end my lecture with my special gratitude to my Dean Sir. Because of his support, we are able to work in our institute. And my PhD guide, Padma Shri Dr. J.M. Vyasar, is the Honorable Vice Chancellor of NFSU, because the institute which has given me this master degree, and he is also my PhD guide. And of course, yeah, Dr. Ashita Acharya, because from whom only we learned forensic odontology. How to do bitemark investigation, I learned from him when I was doing a fellowship under him at Dharwad. Okay, so these three people are, I've always indebted to them for my in my career as a forensic expert. And for this today's event, I thank Dr. Anmol Bagaria and Dr. Ashish Chandra of Cynodent for giving this opportunity. Again, this is the second time in Cynodent platform I am presenting. And this is, of course, in online mode. Earlier, I was in offline mode in Lucknow. So I thank them for this invitation. And today's moderator, Misbah and Shubham, thank you very much for this opportunity and silent listening and moderating this webinar. And lastly, my friends, the students, and all the participants who are listening this webinar online. So I am now open for questions to answer them. Thank you very much. Thanks a lot.
Thank you so much, sir, for such an informative session. Sir, I have a few questions from participants. Should I ask?
Yeah, where can I see their questions?
Sir, we have noted that question.
Okay. So yeah, you can ask the questions, please.
Sir, how hemorrhage can be evidence for the bite mark?
Hemorrhage?
Yes.
Yeah, there is, see, sometimes when there is a upper and lower arch bite is there, because of the tongue pressure and the suction, there is a ecchymosis, petechial ecchymosis may be formed in between them. So that will prove that how much amount of, the violence was involved in that bite mark. It is not only the bite, actually. Along with that, there is some amount of pressure, that suction, that, what do you call that, arrogance in that bitter. So that can be an evidence, like that will show. See, that is how you can differentiate this from in a normal bite mark, or even in a love bite, not that violent, so that is an indication what I can infer, the ecchymosis on this blood spot on this. Yeah.
Thank you so much, sir, for the answer. And once again, thank you so much, sir, for the wonderful presentation. And I would also like to thank the CEO and founder of Cynodent, Dr. Anmol Bagaria, ma'am, co-director of Cynodent, Dr. Ashish Chandra, sir, and my co-moderator, obviously, Dr. Shivam Bharti. And also thanks to all the viewers who joined us today. I request everyone, please like, share, and subscribe our YouTube channel for getting daily updates and webinar. Thank you so much. And sir, once again, thank you so much.
Thank you. Thank you very much. Thanks a lot. So I will stop share this and leave, isn't it?
Yeah,
Fine.
yeah.
Thank you. Thank you.